What is dry needling? Dry needling is the insertion of a filiform needle, such as this. I don't know if you can see. There's the needle. These are called filiform needles in the West. Don't ask me why. Dry needling is the insertion of filiform needles, which are actually acupuncture needles, by the way. Whether the dry needling is done by a medical doctor, a physical therapist, or an acupuncturist, we all use the same needle, and they're all acupuncture needles made in either Japan or China or Korea. The best quality needles are made in Japan. That's what I use. We all use acupuncture needles to do dry needling. Why it's called dry needling is interesting. Many years ago in the 60s, physicians discovered trigger points. And they were treating trigger points by injecting lidocaine into trigger points with a hypodermic needle. And then they did a study in England whether what was most effective, lidocaine, saline, or nothing, just the needle itself. And they found that the needle, putting the needle into the trigger point was just as effective, or actually more effective, or just as effective as lidocaine or saline. And they called that dry needling because there was no saline or lidocaine. In states where physical therapists are not permitted by law to do acupuncture, but where they want to put needles into trigger points to release them, they call it dry needling. And that way they're able to circumvent the law and do that kind of acupuncture. Is dry needling and acupuncture the same thing? Yes and no. Dry needling is actually a form of acupuncture that's based on knowledge of anatomy, knowledge of trigger points. In order to do dry needling, you must be able to locate trigger points and motor points in the muscles. You must have a good knowledge of surface anatomy in order to do that, and general anatomy. And most importantly, you have to have studied how to locate trigger points and the nature of trigger points, what they do, what kind of pain they produce, so that when someone comes in with a specific kind of pain, you all will know, okay, this is most likely due to a trigger point. And then after ruling out other possibilities, then you do what I would call either dry needling or trigger point acupuncture. The difference between dry needling or trigger point acupuncture and normal acupuncture is that when you do trigger point acupuncture or dry needling, you're inserting the needle fairly deeply into the muscle. Fairly deeply means, depending on the muscle, anywhere from 1/4 of an inch to 1/2 of an inch. In the case of the piriformis, which is in the buttock, even as far as 3 inches. There are acupuncturists in China that don't know anything about trigger points, that don't know anything about dry needling, but that actually do that kind of acupuncture, but they just have a different name for it. So many of the trigger points and motor points are actually located at acupuncture points. For example, one of the points I'm going to do on Graham, which is on the upper trapezius, the Dr. Spock point, and Dr. Spock in Star Trek squeezes people there. This point up on the shoulders, where everybody loves to be squeezed and massaged, that's the motor point of the upper trapezius muscle, and it's also an acupuncture point that in the Westerners call gallbladder 21. It's on the gallbladder channel. So it's the same point. So there are people that will release those points, but don't call them trigger points. However, there are whole other styles of acupuncture that have absolutely nothing to do with trigger points. I know many acupuncturists, respected acupuncturists, that don't know what a trigger point is, that don't do deep needling, that don't know how to locate trigger points, and whose acupuncture is solely based on the classical Chinese theory of the acupuncture channels, and who do very, very superficial needling. I like to combine that kind of classical Chinese acupuncture with dry needling because I like to treat people and not diseases. I don't treat trigger points, I treat trigger points on a person. So a case like Graham, who tends to be a little on the more, even though he's an athlete and plays water polo, is a little more sensitive to needles and a little bit more delicate, and also has some other issues of trouble sleeping, and sleep has such enormous restorative value. When I do dry needling on his trigger points, I also add some classical channel acupuncture points to both open up the flow of qi through the shoulder area that I'm treating, and also to calm the mind, relax the muscles, and calm the heart so that he can sleep better.